Hi everybody, my name is Jeanette Lagos and I'm going to be talking about cystic fibrosis. Okay, let's get started. Introduction. Cystic fibrosis is one of the more thoroughly understood genetic diseases. As such, it provides guidance in understanding how a single genetic mistake can give rise to a wide range of medical problems. It also provides a cautionary story. Our ability to understand genes, proteins, and even cells far exceed our ability to understand the complex interactions that give rise to organ-level diseases. I don't know if you guys remember from the gene PowerPoint that Dr. Hughes did, there's a lot of diseases that are the same. One little screw up and tiny little thing can make such a big difference. And we'll explore a little more in depth about, where the screw up is in cystic fibrosis. We will explore the etiology, pathology, signs and symptoms, diagnosis, treatments, and a glimpse of what it is like to live with cystic fibrosis. Etiology. Cystic fibrosis is an autosomal recessive disorder of the exocrine glands. It is the most common genetic lung disease in the United States, with an incidence of 1 in 2,000 to 300 Caucasian births. The incidence in African Americans is rare, 1 in 17,000, and Native Americans incidence is 1 in 80,000 births. It is almost never seen in the Asian population. I know this is supposed to be about a rare disease, and it seems that it's not very rare, but compared, not just the United States, but the world, it is a kind of rare disease. There's only max, I think, that it's ever been has been 100,000 a year around the world. So it's fairly rare, I guess you could say. Etiology continued. 35% of the 30,000 cases of cystic fibrosis in the United States involve individuals older than 18 years. Cystic fibrosis can be classified either as an airflow obstructive disorder or as a pus-forming disorder. Hypersecretion of abnormal thick mucus that obstructs exocrine glands and ducts is a usual finding in the disease. So almost always you're going to find a lot of mucus obstructing glands and ducts in a person that has cystic fibrosis. Pathology. More than 800 mutations in the gene that encodes for the cystic fibrosis transmembrane conductance regulator, the CFTR, have been described. One genetic defect associated with cystic fibrosis involves deletion of the 3 base pairs in codon 508 that code for phenylalanine on chromosome 7. Excuse me. With the loss of these 3 base pairs, the CFTR gene is dysfunctional. So remember we were talking about how one little thing can screw up everything. This is what we're talking about. This mutation is what makes cystic fibrosis. And I'll show you guys a picture. This is the most common genetic mutation causing cystic fibrosis and occurs 60% to 75% of cystic fibrosis patients tested. Cystic fibrosis primarily affects the pancreas, intestinal tract, sweat glands, lungs, and in males it causes infertility. The mucus-producing glands in the gastrointestinal tract enlarge, generating excessive secretions. The thick eosinophilic mucus secretions plug the glands and the ducts of the pancreatic acini, intestinal glands, intrahepatic bile duct, and the gallbladder, causing dilation and fibrosis. These changes result in decreased production of pancreatic enzymes necessary for digestion of fats, carbs, and proteins, thus leading to increased fat and proteins in the stool. The bronchopulmonary system is also affected. The thick tenacious mucus that results from failure of chloride channels to function in the apical membranes of mucosal cells. And we'll see how this correlates with the mutation of the chromosome. Decreased flow of ions and water results in viscid mucus. The thick mucus causes airway obstruction, atelectasis, and hyperinflation. And also decreases ciliary reaction, thus contributing to mucostasis, which provides a medium for pulmonary infection. So because the mucus just sits there and there's so much of it, they almost always get an infection. And we'll talk about it later on. Sweat glands, salivary glands, and lacrimal glands are also affected, leading to high concentrations of sodium chloride in the secretions. So here we were talking about how there's a mutation in the CFTR channel because you're supposed to have the chloride come out and help this mucus along. but because of that, the deletion of the three base pairs in the codon, that makes a mutation of this. Because of that deletion, this is what happens when you can't have the chloride ions go out. And sticky mucus builds up. And this is a little more in depth. I'm so sorry that it's blurry, but I couldn't find a better picture. But basically, this is like, this is a mutation that goes on, which then compromises the CFTR gene. This picture, it just basically shows you how cystic fibrosis affects pretty much, affects pretty much everything. From nose, sinuses, liver, gallbladder, bone, intestines, lungs, heart, spleen, stomach, pancreas, pretty much everything. So it's a very serious disease, and it's not easy to deal with. Okay, clinical manifestations. Typical findings include a history of cough in a young adult or child, thick tenacious sputum, recurrent pulmonary infections, and recurrent episodes of bronchitis. And we remember that's because of the sputum, because it just sits there. These processes ultimately progress to pneumonia and bronchiectasis. I think that's how you read that. Right-sided heart failure and exercise intolerance. Physical exam may reveal digital clubbing, but that's usually a really late sign. Dyspnea, tachypnea, sterna retractions, unequal breath sounds, moist basilar crackles and rhonchi, and a barrel chest that is hypersonic depression. Other findings that may be present are pancreatic insufficiency, cirrhosis of the liver, diabetes mellitus, gallstones, nasal polyps, and failure of development of vas deferens in males. In babies and infants, frequently present with a history of multiple respiratory infections, meconium ileus, failure to thrive, jaundice, salt depletion, and edema. Nutritional assessments reveal depleted fat stores, steatorrhea, fatty stools, anorexia, decreased growth rate in children, and decreased mid-on indices. Okay, so diagnosis. The diagnosis of cystic fibrosis is based on clinical and lab findings. Diagnosis studies that are routinely done include arterial blood gas measurements, pulmonary tests, sputum culture, sensitivity with gram stain, and chest radiography. Specific diagnostic tests for cystic fibrosis include stool examination for fat, pilocarpine iontophoresis, and if you don't know what that is, it's just a sweat test. Because remember how they just want to see how much chlorine, how much salt is in the sweat, since they're not, the channel for the sodium ions is compromised. Stool examination for fat. Oh, I'm sorry, I already read that. And genetic testing. It's a genetic disorder, so it runs in families. Arterial blood gas analysis commonly show hypoxemia and hypercapnia because of airway obstruction. Chest radiographs show evidence of patchy atelectasis, bronchiectasis, obstructive emphysema, cystic bronchioles, and periobronchial thickening. Treatment. Management of cystic fibrosis involves an interdisciplinary approach. A comprehensive program that focuses on multi-organ derangements is recommended. So I'm not just focusing, when you're focusing on cystic fibrosis, you have to remember that there's a whole bunch of stuff wrong. So you have to focus on all the bunch of stuff that's wrong, so multi-organ. Because pulmonary disease accounts for the majority of morbidity and mortality associated with cystic fibrosis, treatment is aimed at aggressive pharmacologic management of pulmonary infection. So they may have a whole bunch of other stuff wrong, but the majority of the reason they die is because of the infection in the lungs. So they usually are more aggressive towards the lung issue. Treatment includes bronchodilators and mobilization of the thick mucus and postural drainage, and test physiotherapy is a priority. High-dose antibiotic therapy is used for acute exacerbations of respiratory infections to decrease bacterial growth in the lungs. They recommend an annual influenza vaccine because of the risk of, the infection that they could get. Nutritional therapy includes unrestricted fat consumption. Because they lose so much fat in the stool, a high protein diet, and vitamin supplements. Because they lose, we talked about how they lose a lot of carbs, fats, and protein, so nutrition is very important. They have to replenish that what they lose. Maintenance of weight in children with cystic fibrosis often requires an intake of 150% of the normal calories recommended, since they're losing so much. They need to eat a lot. Yeah, okay. Treatment. Continued heart-lung or lung transplantation is currently the only definitive treatment. More than 200 cystic fibrosis patients worldwide have undergone transplantation with a 3-year survival of 55%. Which, if you realize, out of the whole world, only 200 people have gone on transplant. That's not a lot. So unfortunately, this is not a common treatment. Only, 200 plus people have been lucky enough to get one. Patients receiving transplant showed marked improvement in mobility, energy, and quality of life. So right here, we have a breathing treatment in both of these. And right here, this is a lung that has cystic fibrosis. So you can see that it's just covered. It's just overwhelmed with mucus. So this is a normal lung, and that's an unhealthy lung. So hopefully, eventually, people will be able to get, it will be more accessible to get transplants. But it's just hard. So yeah, that's what it looks like. Not good. Not pretty. So conclusion. With advances in antibiotic therapy and early recognition and management of complications, patients with cystic fibrosis are living longer into adulthood. Now the median survival age is 31 years, and some patients are having families and leading more normal lives. So it's looking a little better, especially now that, medicine is advancing and they're trying new things. So they are living a they're living up to 31. It's not super long, but it's better than it used to be. Okay, and you guys don't have to do this if you guys don't want to, but I found this story about cystic fibrosis while I was looking stuff up. I came across this story, and it's sad, but it just shows you pretty much what people have to go through when they have cystic fibrosis. This was a little, like 15 years ago when it happened, but it still gives you a very good idea of what it is like to have cystic fibrosis and just like what psychologically it entails and all that stuff. So I'm going to read part of it, and if you guys want to finish it on your own, you can. So this is found in Chicken Soup for this Couple Soul, and it's called Against All Odds. So here we go. They first laid eyes on one another in the spring of 1986, when they were both admitted to the cystic fibrosis wing of Dallas Presbyterian Hospital. Kimberly Marshall was then 16, thin, winter pale, and beautiful, her red hair falling down the back of her pink nightgown. David Crenshaw was 18 and wore his usual t-shirt and faded gray pajama pants. David would stand at one end of the hospital hallway, hoping Kim would come out of her room at the other end. No way, the wing's respiratory therapist would say. No way she's going to look at you twice. On the cystic wing of Presbyterian third floor, about a dozen teenagers and adults inhabit private rooms. Throughout the day, they receive vast amounts of antibiotics throughout intravenous injections. Some have thin oxygen tubes running down their noses. Others use more elaborate machines to open their bronchial passages. Respiratory therapists pound lightly on their chests and backs, hoping to dislodge the mucus in their lungs. And always there is a sound of coughing, dry, flinty coughing, spasms of coughing, the sound echoing up and down the corridor like a cold car engine trying to start. Like a brilliant serial killer, CF is unstoppable. Although an array of pulmonary treatments and medicine allow patients to live more productive, pain-free lives, few survive into their 30s. So we were seeing before how a little more people now are surviving into their 30s, but it's still, they don't live very, very long. It was hard enough to imagine a love affair developing between two cystic fibrosis patients, let alone one between Kim and David. But this is what is so magical about their story. Well, I'm going to leave it up to here, and if you guys want to finish it, you can. It's not really that long. It's only a couple more pages, but it just gives you a really good idea of what people have to go through, even to live normal lives. We're lucky enough to be able to have relationships and not worry about dying. You never know when you might die, but at least we don't have to constantly be worried about it. So I would suggest you guys just read it to get a little better view. But thank you for listening to me, and I hope you guys learned something new. Okay, bye.